Hi, I'm Amanda Holston. I work for Community Health Stockport, the provider arm of services in Stockport. My job is Public Health Advisor. I basically work with all our services from cradle to grave, from head to toe, and I advise them on how to implement public health and put it into practice. Myself and Eleanor Hill had already decided that we needed to look at our training because it wasn't really fit for purpose, and we wanted to improve the level of staff interface with patients. Some of our results came back quite poorly, showing that only 10% of our staff actually felt confident and comfortable in talking to clients, and clearly that's not acceptable. So we decided to take the training right back to basics, and we spoke to staff, we did some focus groups, found out what the barriers were, what the issues were, and how we could make it better. And gradually we used a guinea pig group, and we developed a new package of training, short training, only 2.5 hours. It used to be 2 days, and it just was far too long and far too inappropriate, and staff weren't using it. So we developed this training, and we did it for about 18 months, and then we heard about the MEC sort of campaign, and we presented our findings to MEC to see where we could work together and start using the framework. It's certainly given us some credibility, and we've been able to benchmark what exactly we've tried to achieve. We did it very much informally. We knew it made improvements, but we didn't really have a standard to show. So it's really useful for staff to actually see how they personally improved, and also services to see what level their staff were required to attain. But what we basically did was we kind of took that away from the staff and the managers. We said, if you do this training, you will achieve a level. Certainly having that competence level has really helped in terms of making sure that the training is on everybody's wish list almost. Right. It's kind of, we've actually said to staff, this is really important, managers it's really important, and as an organisation, because it's got some credibility, we've been able to make it a statutory one-off with updates. I think without that we wouldn't have been able to sort of have any power in introducing it. We're basically training anybody who deals with a client or a patient face to face. So it's obviously not somebody who sits at a computer all day. It's somebody who is actually going to be able to talk to somebody. We call our system Health Chats. We've taken it away from brief intervention because that's far too far down the line. Staff weren't doing that. So it's just a normal conversation you'd have between two people, but where the opportunity arises, you have a quick chat about something that's impacting on their health. So we've trained about 750, 800 staff, which is about 85–90% of our frontline staff. Well, within Stockport itself, we've actually done the whole Stockport health economy, so that'd be the council and the foundation trust, who was soon to be joining. But we've basically got a whole systems approach to Stockport, so that everybody knows where they fit in. We've also, because we joined MEC, the MEC movement, we've had interest from other areas who have come to the MEC sessions. We've done a lot of work with Wigan, trying to mirror our package in Wigan. They've taken a lot of the lessons that we've learned along the way. We've been doing it for about 2.5 years now, and we've sort of applied them to Wigan. We've also had East Lancs, Worcester, gosh, the list is quite long. Lincoln, yes, I'm trying to think now. We go on lots of road trips. We've also done Yorkshire and Humber. Karen Payne has commissioned us to do quite a lot, so we've literally done most of Yorkshire and Humber. That's great. All over. That's glamorous locations such as Hull,
I'm sure.
Leeds, basically any glamorous location we've been. Well, for me, this is what we have done is meet MEC level 1. It's not rocket science, it's very simplistic, but what we've done is we've taken a strategy and we've operationalised it. It's about stopping talking about public health and actually making it happen. So it's kind of making every contact happen. We're quite passionate about actually making the improvement for patients and getting it to happen. So what would be brilliant is if everybody could do it, you know, as a one-off. We've tried to get it into student core curriculum. So just for it to be second nature for everybody and for it not to be anything spectacularly special. So for me, if it got integrated across the whole of the UK, that would be fabulous. It's ambitious, but fabulous.